Welcome, everyone, and thank you for joining us for today's CITI program webinar. Today's topic, COVID-19 and Human Subjects Protection Programs. Let me tell you about today's presenters, Brenda Ruotolo and Chalice Polivan Ibrakic. To fulfill her role as Executive Director of Columbia's Human Research Protections Office, Brenda relies on her 25 years of IRB experience with biomedical, social science, and behavioral research. Never has that experience been more critical than now, when all skills are put to the test to safeguard study participants. Chalice has 15 years of IRB experience with oversight of routine operations for 7 institutional review boards. She is a bioethicist and is currently adapting to full-time remote work with a full household, co-homeschooling a 6.5-year-old and keeping a close eye on the dwindling wine provisions. And now, let me pass the mic to you, Chalice.
Thank you, Jamie, for the opportunity to speak to you, and thank you to everyone who is joining in and listening to this presentation today. So today we'll share our experience as a Human Research Protection Office in IRBs at the epicenter of the COVID-19 pandemic in the United States. Today we will discuss our current situation and a brief history of the COVID-19 pandemic as applicable to New York City. We'll share the actions that we've taken as an academic, medical, and social behavioral institution to prepare for and in response to the pandemic. We'll also discuss our recommended considerations for HRPPs as they work through the same challenges. And we will identify strategies that institutions can employ during this time related to the very important key stakeholders that we are dealing with, as well as discuss considerations for ongoing research during the pandemic.
Okay, so now I'd like to move on to key strategies that institutions may employ to plan for and deal with a situation like the present pandemic. I think it's critical to say and to always keep in our minds that nothing can replace the benefits of advanced planning. Chalice mentioned it, and I will reiterate it. I am gratified that our leadership was proactive in addressing research, considering that much of it would need to pause because the resources wouldn't be available, because the risk to the participants may not be justifiable, and so on. I do want to go back to a point that Chalice made a little bit earlier about perhaps not knowing what crisis or emergency your institution might encounter, and therefore maybe not having a disaster preparedness plan because you don't know what will be coming your way, and so you don't know what your plan should include. I think many disasters that institutions prepare for are environmentally based, like floods or hurricanes or tornadoes. We've certainly had some of those in our area, particularly Superstorm Sandy a number of years back. And in those cases, the IRB and the institution's priority is to think about relocating participants in clinical trials because they can't physically come to the space. A pandemic like this is quite different. Physically, the space was intact, but we had to consider the risk that traveling to a study visit might present to a participant and assess whether the potential benefit outweighed the incremental risk. It's a very different set of circumstances, but nonetheless, a core disaster plan that will address alternatives for operations so that core operations can continue is essential, and there are certainly models out there for it, and I would encourage everybody to have one of those if they don't already. These plans, these core plans, can be modified at the time that a situation actually does arise. Another key strategy is so key concepts here. Let's just kind of get to the summary. We're Human Research Protection Program administrators. We are charged through the regulations with the safety of the participants in human subjects research studies, and so that has to be paramount, the highest priority. But I would caution to avoid mission creep and stick to the human subjects issues. So if you're drawn into, because you're an efficient person, because you're a knowledgeable person, because you get things done, you have good ideas, and you're pulled into other areas, be sure you have the bandwidth to do that when your priority is the safety of your participants. Flexibility, critical. In terms of personnel, as Chalice mentioned, changing working hours, telecommuting. IRB reviews, we're now approving consent forms that we don't entirely love and that we know need changes, but we're approving them as is, provided the information is accurate, but with an addendum that has to be presented to the participant. And in this way, they can enroll those participants in those critical intervention studies immediately while they are revising the consent form. We are discouraging modifications, something that really gives us all a whole lot of agita, okay? Because we are compliance people and we like everything documented in our system, and yet we have told our researchers not only are you not required to submit to us for prospective IRB approval, the changes that you're making to reduce in-person contact in order to reduce the risk, the imminent hazard to a participant, we don't want them. We could not turn around the new COVID-19 related studies at the rate that we are doing if any significant percentage of our 6,500 plus studies submitted modifications to us to tell us that they were going to a verbal consent process. We are telling them to implement those changes. They are going to have to report them to us, but right now they need to just get it done. I would say that in terms of flexibility,
we encourage everyone watching this webinar to monitor the CITI program website for additional information about future webinars, available on-demand recordings of past webinars, and our new all-access webinar package.